What if I told you that the food on your plate could be the silent driver behind the global obesity epidemic? Overweight and obesity have become major global public health problems, with alarming increases in BMI worldwide. From 1980 to 2013, the proportion of adults with a BMI of 25 kg/m2 or greater skyrocketed. But what's fueling this epidemic? Is it just our sedentary lifestyles, or is there more to the story? A significant factor might be the increased food energy supply and the globalization of the food supply. Ultra-processed foods have become more available, contributing to population weight gain. We investigated the link between changes in national food energy supply and average population body weight. Data was collected from 24 high, 27 middle, and 18 low-income countries. We looked at average measured body weight from global databases, national health surveys, and peer-reviewed papers. Changes in average body weight were derived from study pairs at least 4 years apart, spanning from 1971 to 2010. Food energy supply data was retrieved from the Food and Agriculture Organization's food balance sheets. We estimated population energy requirements using Institute of Medicine equations. Finally, we estimated the change in energy intake that could theoretically account for the observed change in body weight. In 56 countries, an increase in food energy supply was associated with an increase in average body weight. In 45 countries, the increase in food energy supply was higher than the model predicted increase in energy intake. The association between change in food energy supply and change in body weight was statistically significant. This was especially true for high-income countries. Our findings suggest that increases in food energy supply are sufficient to explain increases in average population body weight. Policy efforts are needed to improve the healthiness of food systems and environments to reduce global obesity. The drivers of the obesity epidemic have been much debated. Some argue that reducing physical activity is a predominant driver of the obesity epidemic. Others point to the oversupply of food energy as the main culprit. A model predicts that a sustained increase in energy intake of 100 kilojoules per day leads to a predicted increase of 1 kilogram body weight. This model suggests that the oversupply of food energy is sufficient to drive the increase in body weight. Despite increased food waste, the oversupply of food energy still contributes to weight gain. Our study tested the hypothesis that an increase in food energy supply is sufficient to explain increasing population body weight. For most countries, the change in food energy supply was greater than the change in energy intake needed to explain weight gain. This pattern was observed across countries of all income levels. In high-income countries, a growing and excessive food supply is contributing to higher energy intake and increasing food waste. Other factors, such as a decrease in physical activity, may also lead to an increase in body weight. Policy efforts should focus on reducing population energy intake through improving the healthiness of food systems. To combat obesity, we need major action by governments and the food industry. Let's make a change for a healthier future.